I think that the value of networking with people from different contexts is critical, because one appreciates that there are universal principles for healthcare delivery. And certainly one of the strongest themes that has come out is that the delivery of care is as important, if not more important, than the clinical aspect of care that we too often focus on. And even in resource-poor environments, such as African countries, we need to consciously focus on the delivery of care and not the clinical science of care. And I think some of the tools that were discussed, both strategic and operational, are useful in that context.
How complicated and how many different definitions there are of what it means to really be innovative. I think we talked a lot about that, and we've made full circles, whether this needs to be one person never saying no to something or a group effort that might take a long time. So I think that just acknowledging that there are sort of different ways of approaching innovation is in healthcare is important.
I'm impressed for this very comprehensive and creative seminar. This knowledge is important for our thinking, speak on reforms in healthcare in Serbia for future.
I learned about speed. Some of the accomplishments that we've heard about were deliberate, they did take time, but in reality they occurred with remarkable speed. So agility and constantly challenging ourselves. Can we go faster without violating some of the main concepts we learned here about testing? That to me is a real important point.
That even though we come from very different perspectives, or seemingly different perspectives, the fundamental problems are the same, and the fundamental questions that we're asking are the same. And they're not only the same now, they were the same, 30 years, 40 years ago. And as much as those questions are about cost effectiveness and those things, I think the underlying thread is a moral question, of how do we provide, or, who's supposed to be providing care and what sort of care they're supposed to be providing.